Dear students, welcome to readmedprep Academy channel. Today we are going to discuss about human reproductive health part 2. In this we are going to discuss about population explosion, birth control methods and medical termination of pregnancy. Going to population explosion, you know that increased health facilities and better living conditions has enhanced the longevity of the individuals. The lifespan, which was 69.6 years in 2015, that was actually 62 in 2000. According to a recent report from the United Nations, India's population has already reached 1.26 billion and is expected to become the largest country in population size, that it can surpass China around 2022. To overcome the problem of population explosion, birth control is the only available solution. People must be motivated to have smaller families, to do family planning, and also use the various contraceptive devices. The entire bureaucrats are worried about how we should control the India's population explosion. Advertisement by the government in the media as well as in the posters, bills, etc. with a slogan, Nam Iruvar, Namakku Iruvar, we too, us too, have also motivated to control population growth in Tamil Nadu. We too, us too is the slogan that you can see even behind the vehicles. In India, statutory rise of marriageable age of female to 18 years and that of males to 21 years. Incentives are given to couples with smaller families are the measures taken to control the population growth in the country. In India, the marriageable age for the girls is 18, whereas in males it is around 21. In China, if you take, the marriageable age for the girls is 20 and the marriageable age for boys is 22. If you take the lowest, Malaysia, where the marriageable age for girls is around 16 and the marriageable age for boys is around 18. Birth control methods that should be adopted to control the population explosion. What are they? The voluntary use of contraceptive procedures to prevent fertilization or prevent implantation of a fertilized egg in the uterus. See, the fertilization can be prevented between a few minutes to 5 days after intercourse. Similarly, the implantation can be prevented between 5 to 15 days after intercourse. What is an ideal contraceptive? It should be user-friendly, it should be easily available, it should have least side effects, and should not interfere with the sexual drive. There are two types of contraceptive methods. One is called temporary, the other one is called permanent. When you take the methods of contraception, the classification, one on the temporary side, you can see the barrier methods, the natural contraceptive methods, the intra-uterine contraceptive devices, otherwise called IUCDs, and steroidal contraception. On the permanent side, we have for the females the tubectomy and for the males it is vasectomy. Now when you take the temporary birth control methods, it is physical method or the natural method, the chemical method, the mechanical method and the hormonal barrier method. Now when you take the natural birth control methods, they prevent the meeting of the sperm and the ovum. So there are about 4 types. One is the rhythm method or the safe period method, the coitus interruptus, the continuous abstinence method and the lactational amenorrhea method. In the rhythm method, otherwise called periodic abstinence method, normally the ovulation occurs at about the 14th day of the menstrual cycle. The ovum that is released survives about 2 days, whereas the sperm remains alive for about 72 hours, that is 3 days in the female reproductive tract. So it is advisable to avoid sexual contact or coitus during the fertility period. The fertile period for a woman is between 8th to 19th day. So it's always better to avoid sexual contact between the 8th and the 19th day. From the 28th day of the menstrual cycle till the 7th day of the next cycle, sexual contact can be done. Now what is continuous abstinence method? It's a simple method and the most reliable method. It's a method to avoid pregnancy. That is to not to have coitus for a defined period that facilitates conception. Abstinence means not to have sex. Now what is the third method? That is called coitus interruptus. That is the oldest family planning method, where the male partner withdraws his penis before ejaculation, thereby preventing the deposition of the semen into the vagina. Now, this coitus interruptus, when the semen ejaculation is prevented or made outside the vagina, the precoital secretion that may contain some sperms. Even one drop of semen is sufficient to cause pregnancy. What is the side effect of this coitus interruptus? Pelvic congestion and vaginismus. Now, the fourth method is lactational amenorrhea method. In this method, the menstrual cycle usually resumes as early as 6 to 8 weeks from parturition. However, the reappearance of the normal ovarian cycle may be delayed for 6 months during breastfeeding. The delay in the ovarian cycle is called lactational amenorrhea. It serves a natural method, but it is an unreliable method of birth control. It has been shown that the lactational amenorrhea method is very effective up to 99% if it's correctly used. What is the mechanism of action? How birth can be prevented during this time? Suckling by the baby during breastfeeding stimulates the pituitary to secrete increased prolactin. This prolactin hormone, in order to increase the milk production for the baby, this high prolactin concentration in the mother's blood may prevent the menstrual cycle by suppressing the release of gonadotropin releasing hormone from the hypothalamus. When the inhibition of gonadotropin releasing hormone occurs, this also inhibits the release of gonadotropin from the pituitary. What are the gonadotropins? The luteinizing hormone and the follicle stimulating hormone. Here you can see the beautiful feedback mechanism that occurs. Suckling or breastfeeding causes the inhibition of the hypothalamus to inhibit the release of gonadotropin releasing hormone, and this further decreases the release of the anterior pituitary hormones like the luteinizing hormone and the follicle stimulating hormone. Even some quantity of the estrogen that is released from the ovary also inhibits the release of gonadotropin from the hypothalamus. Now, let us discuss about the barrier methods of contraception. What is the principle of the barrier method? In this method, the ovum and the sperm are prevented from meeting so that the fertilization does not occur. What are the types of the barrier methods? The chemical barrier, the mechanical barrier, the hormonal barrier, and the intrauterine barrier methods. You can see in this diagram that the oral contraceptives work on the ovary, the intrauterine devices work on the uterus to prevent fertilization and implantation, and the cervical caps and the cervical diaphragm work on the cervix, whereas condoms work on the vagina. Now, what are the chemical barrier methods? That is the foaming tablets, the melting suppositories, the jellies, the creams, the sponges, and the films. These chemical agents inactivate the sperms in the vagina. Hence, they are spermicidal. Here you can see the 6 types of spermicides, which kills the sperms in the vagina once they are ejaculated. What are the mechanical barrier methods? In the males, condoms are used as the mechanical barriers. Condoms are thin sheet of material that are used to cover the penis of the male, which is the copulatory organ. And the condoms are made up of polyurethane, latex, or sometimes lambskin. Once it is used, the condom should be discarded immediately after the use. Here you can see the male condom. In females, the materials are used to cover the vagina and the cervix just before coitus, so as to prevent the entry of the ejaculated semen into the female reproductive tract. Here you can see the female condom. The upper side is shown that enters and fixes towards the cervix, and the outer part is fixed to the labia majora. What are the uses of the condoms? This prevents conception. Condoms also safeguards the individuals from sexually transmitted diseases and AIDS. Diaphragms, cervical caps, and vaults used in females are made of rubber and are inserted to the female reproductive tract to cover the cervix before coitus in order to prevent the sperms from entering the uterus. Here you can see the diaphragm. It blocks the cervix, thereby prevents the entry of sperms into the cervix. It is usually used with a spermicidal jelly, and it will not protect against sexually transmitted infections. It is reusable. Whereas a cervical cap, if you see, it may be inserted 6 hours prior to sex and must be there in 6 hours after sex. 80% to 94% is effective, and it requires correct fitting, and it requires a prescription from a doctor. What is hormonal barrier? It prevents the ovaries from releasing the ova. It thickens the cervical fluid, which keeps the sperm away from the ovum. Oral contraceptives are used, like pills, to prevent the ovulation by inhibiting the secretion of FSH and LH hormones. A combined pill is also the most commonly used birth control pill. It contains synthetic progesterone and estrogen hormones. Contraceptive pill called Saheli is available in India, which was devised by Central Drug Research Institute in Lucknow, India, CDRI in Lucknow. It contains a non-steroidal preparation called Centcroman. Intra-uterine devices. Intra-uterine devices are inserted by medical professionals and experts in the uterus through the vagina. Here you can see how an intra-uterine device fits in the uterus. These devices are available as copper-releasing intra-uterine devices, hormone-releasing intra-uterine devices, and non-medicated intra-uterine devices. In this, we can see the different types of devices like copper 7, Lippes loop, progester cert, copper T, T-coil, Dalcon shield. Action of IUDs. How does these intra-uterine devices work? They increase the phagocytosis of the sperm within the uterus. IUDs are ideal contraceptives for females who want to delay pregnancy. Here you can see diagrammatic representation how the intra-uterine devices act. It thickens the cervical mucus to prevent the sperm from entering the uterus. Second, it causes the endometrium to thin out so that the implantation of the fertilized ovum does not occur if it occurs. Inhibition of the sperm from reaching the fertilized egg. What is the success rate of IUDs? It is one of the popular methods of contraception in India. It has a success rate of 95 to 99%. Now let us see the different types of IUDs. The copper-releasing IUDs differ from each other by the amount of copper. They can remain in the uterus for 3 to 5 or 5 to 10 years. Different types of IUDs containing copper are CUT 380, Nova CUT, CUT 380 AG, Multilode 375, etc. These release the copper salts in the uterus and suppress the sperm motility. You can see in this the different parts of the copper intra-uterine device. It has a horizontal arm, it has a vertical arm, it has a threads, and this is fitted on one end of the insertion tube. On the other end, a solid rod is inserted, and through the cervix the insertion tube is inserted and the solid rod pushes the CUT inside the uterus. Now what about the hormone releasing IUDs? Example is progester cert and LNG20. They are often called as intra-uterine systems. They increase the viscosity of the cervical mucus and they prevent the sperms from entering the cervix. You can see in this that it has a horizontal arm made of polyethylene. It has a ethylene vinyl acetate copolymer, which is a vertical arm, and this vertical arm contains 38 milligram of progesterone microcrystals and barium sulfate suspended in silicone oil. The progesterone is released in small quantities. Now, non-medicated IUDs. Non-medicated IUDs are made up of plastic or stainless steel. One example is Lippes loop, which is a double S-shaped device. Now, let us discuss about the permanent birth control methods. These are adopted by individuals who do not want to have any more children. These are called surgical sterilization methods. How does this work? It prevents the partner's gametes to be released and the semen does not come out, and similarly the female, the egg does not reach the uterus. It's a permanent contraception method advised for male and the female partners who no more want any pregnancy. It blocks the transport of the gametes and prevents conception. In the female, the method is called tubectomy, and in the male, it is called vasectomy. Tubectomy is the surgical sterilization in women. How it is done? In this procedure, a small portion of both the fallopian tubes are cut and tied up through a small incision in the abdomen, or this procedure can also be done through vagina. Here you can see the location of the fallopian tubes being tied and cut. Now, tubectomy prevents fertilization as well as the entry of the egg into the uterus. Now, what is vasectomy? It's a surgical procedure for male sterilization. In this procedure, both the vas deferens are cut and tied through a small incision on the scrotum to prevent the entry of sperm into the urethra. Vasectomy prevents the sperm from heading off to the penis as the discharge has no sperms in it. Here you can see the location of the vasectomy site, and the vas deferens is cut and tied on both sides. Now, what is this contraceptive failure? Approximately half of the unintended pregnancies are due to contraceptive failure. What are the causes? Mainly because of incorrect usage of contraceptive methods or inconsistent usage of contraceptive methods. The effectiveness of long-acting reversible contraception, IUDs and contraceptive implants, when used effectively in a proper manner, is superior to that of the contraceptive pills, patches or rings. And this is not altered even in adolescents and in young women. Here you can see that the intra-uterine devices, the failure rate is very zero, whereas the failure rate with the rhythm method or the pills is higher. How to overcome the contraceptive failure? We have to educate our young women about the usage of the intra-uterine devices as well as the contraceptive implants. That would dramatically reduce the number of unintended pregnancies among women seeking family planning. So we have to advise the women regarding the various techniques of usage of birth control methods. Now, let us discuss about the medical termination of pregnancy. What is the definition? It's a medical method of abortion. It's a voluntary act or intentional termination of pregnancy in a non-surgical or non-invasive method. So when is MTP safe? It is safe up to 12 weeks. That is the first trimester of pregnancy, and generally has no impact on the women's fertility. So it is safe between 0 to 12 weeks. When it is unsafe, abortion is unsafe during the second trimester and is more risky as the fetus becomes very intimately associated with the maternal tissue through the placenta. So Medical Termination of Pregnancy Act was established in 1971. Unsafe abortion is killing one woman every 2 hours in India. So legalization of MTP was done because of these social consequences with certain restrictions like sex discrimination and illegal female feticides to be avoided. So that was misused. What are the indications of the MTP Act? The continuation of pregnancy constitutes a risk to the life or grave injury to the physical or mental health of the woman when the pregnancy is dangerous to the woman's health. Substantial risk of physical or mental abnormalities in the fetus as to render it seriously handicapped. Pregnancy caused by rape that is presumed to cause grave injury to the mental health of the person. Contraceptive failure in married couple, presumed grave injury to the mental health. Now, illegal MTP. These illegal MTPs were performed by unqualified quacks in an unsafe manner and in an improper manner. So that caused fatality. MTP of the first conception may have a serious psychological consequences. 3 to 4 million illegal abortions take place in India. The rate of maternal deaths due to illegal or unsafe abortions is 58% in India. So MTP Act was brought in. What is the significance of MTP? It helps in getting rid of unwanted pregnancies. MTP also contributes to decrease in the population. What are the drawbacks of MTP? It was used as a weapon for female feticide. In India, it was illegally performed. Even now it is illegally performed by quacks and unqualified people, leading to death of the mother too. So, in this lecture, we have discussed about population explosion, birth control methods, and medical termination of pregnancy. Thank you very much. Kindly subscribe, like, share, and comment our channel Read MedPrep Academy. Kindly post your questions in the comment box. We will reply the questions with proper answers. Log on to www.readmedprepacademy.com. Our Facebook ID is Read MedPrep Academy. Our email readmedprepacademy@gmail.com. Thank you very much.